This week in my Lamaze class, let's take away the power that pain has on us and the fear associated with it by learning a little bit about it, why it's useful in labor, how it can be minimized, and really super stupid simple steps on how to reduce your pain in labor. That's next. How many times can I say stimulation in one video? Welcome back to my channel. If we've never met, I am Mandy. I am the birth nurse. I believe that women's bodies are powerful, and with the right support, we are unstoppable. If you agree or you love learning labor tips, learning all about birth and what comes next from a labor nurse, consider subscribing and don't forget to hit that bell so you'll be notified of next week's lesson. I am sharing my Lamaze classes here online so that you can follow along and help prepare for your birth, help you feel more confident, and help you know a little more about what to expect so that you can have a positive birth experience, feel like you're contributing, making decisions, and you know what's going on in the process. Today, let's start with pain. Why pain is important in labor, why we shouldn't hate it and groan about it, and maybe we can even use it to our advantage, and really easy ways to reduce pain in labor. And I don't mean a birth ball, even though I love them. That's not what I mean today. First, before we begin, I mentioned fear. So let's reduce the power that fear has on us and all of that energy that we're using to have fear, to be afraid, to think about the what ifs and all the possibilities and all the bad things that could happen. That is fear in childbirth. While it is useful and there is no way to get rid of all of it and mitigate every single aspect of fear or part of fear, let's just store it away for right now. So I want you to write down or type down on your phone or comment below one fear that you have about birth. Remember, we talked about in a past lesson fear, tension, and pain and how they're related. Well, reducing fear can reduce tension, which can reduce pain. Woo! So we have to practice reducing fear, even if we have to tell our minds and trick our minds. So write it down, comment it here, or just type it out somewhere. That alone, just saying it or getting it out there on paper, can have a huge impact for how it looks and how it feels to you reading it than feeling it. So once you've done that and you read it, see if there's a change immediately, even right away, and that's all you do. If you're taking this class online, then discuss that with your partner. What are your fears, or a family member or a friend? Say them out loud and then discuss them so that you can now be responsible for helping to reduce them. Maybe it's something that you can't change, but maybe it's something that you will grow to either be okay with or not constantly worry about because you can't change it. I think this can be a powerful activity. It is not easy to do, and it is not always fun, ever fun to do, but it is important to do. If you're going to reduce your fears, you have to say them, own them, let them out. It's okay to have fear. They cannot consume you, and we don't want them to increase our pain or worsen our pain. So we do these exercises to try to reduce them, but it's okay. You have them, they're there, own it, write it down, say it, or type it out. Let's talk about science. Don't stop the video. It's brief science. Nerve fibers, pain fibers, and sensory fibers. They're different. Okay, two types of nerve fibers: large, fast nerve fibers and small, slow nerve fibers. The fast nerve fibers, the fast ones, are stimulated by sensory stimulation. So sensory stimulation can travel quickly to your brain. The pain sense can travel slower to your brain. If large, fast nerve fibers are stimulated, then they can block or partially block pain sensations. I know, mind blow, I know. So what does that mean? And when can I stop talking about nerve fibers? That means basically that if you activate one of the 5 senses, smell, touch, see, taste, hear, and they are stimulated by something that feels good, then those sensations can reduce the actual amount of pain that travels to your brain. And your brain says, I'm having pain. So your brain cannot comprehend pain or as much pain if you have something else going on that feels good. That's powerful. That means that you and your support person have a huge effect on how much pain you experience in labor. You can't completely control it, and I will talk more about pain in just a minute and why it's important and why it's there and how it can be useful, but you can reduce some of it. So let's talk about ways to reduce some of it. So first, sense of touch. Things that feel good by touch can be, all of this can be homework. So finding things that feel good, sound good, taste good, smell good to you is part of your homework so that you can have them in your toolbox and pull them out or your support people can pull them out when you need a new positive sensory stimulation in your labor. Things that feel good, touch. So that is touch from a loved one, touch from your support person. It can just be like good massage that feels good to you. You and your support people, if you have someone on your labor list that is going to be there with you, your significant other, your partner, your doula, your mom, your sister, if someone's going to be with you, you guys need to work on good touch. So positive stimulation, that is physical. Head scratching, head massage, shoulder rubs, back massage. You can pack things in your bag that you like. So if you like your hair being brushed, pack a hairbrush. If you like a tennis ball rolled onto your lower back, that's a great item. Or a can, like a can of soup, rolled on your back just to get those knots out. If you hate shoulder massage in real life, you probably aren't going to love it in labor. A few things, I like a chopped up pool noodle like this. This is about the size of a useful, or maybe even smaller, of a useful pool noodle. You can roll this along Prego's back to kind of help counter pressure and help some back support. Tennis ball, any back massager like this one, which also looks like a torture device, can actually feel really, really good, especially if you've had any tension going on in labor or later in pregnancy. This can help that feel really good. Also, it's really common in labor for a woman's hormones to change what temperature is comfortable. She could be sweating 1 minute and freezing the next and sweating again the next minute. So temperature that feels good, or heat applied to her body, or ice applied to her body. That could be her back, like cold pack on her back. Warm water on her belly could feel good. And later on during transition and pushing, warm, wet compress on her perineum can feel good. All of those can reduce the pain sensation. Sense of smell. Sense of smell can be or is one of the most powerful senses triggered with memory. So sense of smell is often forgotten in labor, but incredibly important. You are possibly giving birth in a hospital. What does a hospital smell like? Probably not your house, probably not somewhere where you feel comfortable. It's sterile, it smells like cleaning supplies, other people, smoke, cleaning supplies, sick. Depending on where you're giving birth, it might not smell comfortable to you. So you have to change that. Take aromatherapy, things that smell good. Take odoriferous snacks, maybe that you don't even want to eat, but like oranges, they smell good or they help your room smell good and you don't want to do oils or aromatherapy, just an orange might perk you up, might give you some energy, might make you feel better. I like cookies, like fresh baked cookies. So maybe pack some cookies for your support people to snack on, and you would be smelling that. I would not pack something that you don't like the smell of, because that can be powerful too. Also, having familiar items in your room like a pillow is going to smell like your home. Being next to someone that you live with or that you're close with, you're going to be able to smell them, and that can be comforting too. The sense of sight. This can be internal mind's eye, like visualization. So maybe during your relaxation techniques or relaxation time, breath work, breath awareness, you are visualizing a place or situation, or however you visualize birth, positive birth. That can be helpful. If you were reminded about that visualization, that can be kind of your sense of sight. But also people that you are familiar with, or a focal point. So bringing something to your birthplace can be very, very powerful. What is your focal point? What is the purpose of the pain? What is the purpose of labor? Why did you decide to have a baby? Why did you decide not to have pain medication? Or what is going to be your first meal? I've seen all kinds of focal points. Onesies, baby clothes. I've seen photos, images, drawings that women have done, or pictures of something powerful. They can all help you feel good, feel strong, and block that pain. Sense of hearing, our fourth sense of hearing. Listening to music or positive affirmations from your birth partners or your support team can be very helpful. And taste. Tasting something that you like, that's comforting, that brings back memories. Sometimes a sour taste can help with nausea. A hard candy that you're familiar with or that you like. Having things that are familiar, even taste, or drinks like Gatorade. Get what you like. Get drinks that make you feel good. Get drinks that have positive vibes with them. If you drink something when you do heavy workouts, bring that, because you're going to remember how strong you are when you have that taste. If you're ready for this full lesson, you want to dive deeper, learn more about pain and how to use it to your benefit in labor, then click the link below. My full childbirth series is online, so it's so easy for you to get and to start practicing and start learning from today to have a more confident and positive birth experience. Thanks for watching. Consider subscribing. Don't forget to hit the bell and share with a prego friend. I'll see you next time. Also, to continue the conversation or to connect with me, if you have questions, definitely comment below. You can also find me at the Facebook group that I mentioned earlier, I think, all about birth and what happens next. I go live on there every week. I'll see you there. Bye now. Woo.